In this exercise, you will learn how to perform a basic facial service, which includes cleansing and massage techniques. Once you've completed the preparation phase of this exercise, you may begin the service. Have your client put on a gown and drape the client in a cocoon wrap on the bed. Be sure to wash and sanitize your hands before any contact with the client's skin, and wear gloves. Next, properly cleanse the face. Start with the removal of eye makeup. Use cotton and makeup remover while performing downward and inward strokes. Use a cotton swab to remove eyeliner from the top and bottom eyelids. To remove the lipstick, use a tissue and begin from the outer corner of the mouth to the center on both sides of the lips. Obtain cleansing cream with a spatula and apply to both hands. Starting at the chin, distribute cleansing cream evenly over the face and neck using both hands. It is important to use smooth, sweeping strokes. When cleansing around the eyes, work gently over the eyelid and toward the bridge of the nose. Next, remove the cleansing cream using cotton pads and warm water. Start at the throat and follow the contour of the face, working upward. Follow this procedure until all the cleansing cream is removed. Apply a toner to the skin surface with a piece of cotton. This restores the skin to its natural pH and aids in the cleansing. Place eye pads over the client's eyes. Analyze the client's skin with a magnifying lamp to check for skin abrasions, excessive oil, flakiness, or clogged pores. Apply an exfoliant product to the client's skin. For a granular scrub, apply and massage in small circular movements. If an alpha hydroxy acid product is to be used, apply the product and let it stay on the skin for the given amount of time. Be sure to cover the entire face except the eyelids and mouth. For enzyme exfoliants, apply steam for 10 minutes. Always follow manufacturer's directions. To remove the exfoliant, wrap a hot towel around the client's face. Remember, if you are using a hot towel, allow the steam to release from the towel first in order to avoid client discomfort or burning. Gently pat down the towel to absorb some of the product. Then, use the towel to wipe away the exfoliant. Once you've removed the exfoliant, which can also be done with cotton pads, apply a toner to close the pores. Apply massage cream to the face and neck. Perform massage movements beginning at the forehead. Apply pressure to the forehead using a hand-over-hand effleurage movement with the ring fingers. Cross the forehead, moving from one side to the other and back again. Use slow, rhythmic movements for a soothing effect. Slide the middle fingers of both hands over and under each other continuously as you move across the forehead in half-circle movements. Work from one side of the forehead to the other and back again. Use the pads of your middle fingers and work from one side of the forehead to the other in circular movements. Apply slight pressure at the temples, then circle the eyes with your ring fingers. Now perform tapotement around the eyes. Use your ring finger to create a figure 8 around the eyes. Pause at the temple area. Massage the outer corners of the nose, slide your fingers up either side of the nose, and apply pressure into the eye sockets. Repeat this movement 3 times. Perform scissor movements on the nose by creating a V pattern with your index finger and middle finger, starting at the base of the nose and sliding up to the hairline. Do this 3 times. Gradually work into the tapotement movement on the cheek area. Next, use petrissage techniques. Lift upwards slightly on the corners of the mouth at least 3 times on each side. Perform scissor movements on the mouth by creating a V pattern with your fingers on both hands and slide across the mouth. Then, move to the chin and repeat the same movement. Massage the neck in a small circular motion using both hands. Perform circular petrissage movements as you work upward along the jawline using your thumb and index fingers. Work toward each earlobe. Repeat the petrissage movements at least 3 times. Glide to the sides of the mouth and perform circular movements. Then continue to the sides of the nose and perform circular movements. Glide up the sides of the nose and apply light pressure at the eye sockets. Repeat these movements 3 to 5 times. Perform effleurage on both sides of the face. Continue by crisscrossing your hands over the forehead to each temple. Pause, then release. Use cotton pads to thoroughly remove the massage cream from the face. Then immediately apply a toner. Apply a facial mask to the entire face, starting at the throat. Use a brush in long strokes. Work across the throat and chin. Then work up the cheeks. Be sure to cover the entire area, including the upper lip. Work toward the other side using the same techniques. Apply the mask along the nose. Cover the entire face with the mask. Reapply product as often as necessary to the brush. Allow the mask to set on the face for approximately 5 to 10 minutes, or according to manufacturer's directions. Then remove the mask with a hot towel. Allow the steam to release from the towel prior to placing it on the client's face. Gently pat the towel down to allow it to absorb the mask. Then gently wipe off the mask. Once you've removed the mask, apply the toner. Finish the facial by applying a moisturizing cream over the entire face and neck using éclairage movements. Once you finish the basic facial, perform the completion phase of this exercise.